delighted to welcome Alanna Kit. She's a neuroscientist, a researcher in the field of psychedelics, and you do a lot of breath work, yoga, and a meditation facilitator. There's so much evidence and proof how psychedelics can help. I'm going to let you, in your words, explain to us how it's out there now for therapy.
Yeah, I mean, it's a very multifaceted therapeutic. It's being used for depression, anxiety, PTSD, OCD, food addiction, trauma, but it's also great for somatic therapy as well, which is where a lot of trauma lives in the body. And I think we're starting to not only look at it from a central nervous perspective, but also a peripheral. So my research is going into a lot of like chronic stress and inflammation and preventative of diseases before the symptoms manifest, right? So before we have these neuropsychiatric symptoms, how can we actually use it as a preventative approach to increasing neuroplasticity, decreasing perceived stress, regulating our hormones, optimizing our gut-brain axis function. We can start looking at it from genetic perspective, a mitochondrial biogenesis approach, cellularly, but also more on the clinical side of reported symptoms. So we're going at it from multiple different angles.
Someone that asked you what psychedelics are we talking about, and I mean, you said MDMA,
Cybin, 5-MeO-DMT, LSD.
Is there anything that you'd recommend to, and for what reason?
Like I said before, I think it really depends on how you want to approach the space. You can look at it from a pharmaceutical perspective. You can look at it from an alternative health perspective, spiritual perspective. The most important thing is to be able to support yourself from a pre and post psychedelic journey as well. There's no point in taking a psychedelic if you don't have the proper procedures in place and setting. So it's all of it, right? It's the full patient journey of preparing that patient for that profound mystical experience.
So I guess what we're trying to say, or what she's trying to say, is don't just go and buy some illegal drugs and
find a good practitioner. Have those proper integration tools and strategies in place afterwards. But it changes people's lives. It is so profound on such a deep cellular level to look at the world differently. And it's been beautiful to see, many people anecdotally having a psychedelic journey and it changing their lives, and also them being a better person.
It's more popular than you think. That's the thing.
Yeah. And I think people are looking at healthcare differently now. They're like I said before, it's self-empowerment theory. You are becoming your own healer. You are taking that responsibility to look after your full spectrum of wellness and health.
Thank you.
Thank you.